Today's topic is hepatitis. Hepatitis is an inflammation of the liver, and this condition can be self-limiting or can progress to fibrosis, cirrhosis, or liver cancer. It is either acute hepatitis or chronic hepatitis. Acute hepatitis defined as any syndrome that causes elevation of liver function tests and resolves in less than 6 months. While the chronic hepatitis is defined as any hepatitis lasting for 6 months or longer. Hepatitis viruses are the most common causes of hepatitis in the world. Other infections, toxins like alcohol, certain drugs, and autoimmune disease can cause hepatitis. There are 5 main hepatitis viruses referred to as type A, B, C, D, and E. Viruses causes illness that have similar clinical and pathological features. Frequently enteric and even asymptomatic, tendency to cause acute and chronic infections. If you see the causes in this, the common is the hepatitis A, hepatitis B, along with or without hepatitis D. That means that hepatitis D depend upon hepatitis B for their function. Hepatitis E, hepatitis C. Less common is the cytomegalovirus, Epstein-Barr virus. Rare is the herpes simplex and yellow fever, which causes a viral hepatitis. Acute viral hepatitis. The common clinical features are non-specific prodromal illness, where the patient having headache, myalgia, arthralgia, nausea, and anorexia. Usually precedes the development of jaundice by a few days to 2 weeks. Icteric phase, that is when the jaundice appears, the vomiting and the diarrhea may follow, and abdominal discomfort is common. The patient having dark urine and pale stool, which precede the jaundice, and itching may be present. Physical signs: the liver is often tender and minimally enlarged. Occasionally, the mild splenomegaly and cervical lymphadenopathy are seen in case of Epstein-Barr virus infection. Symptoms rarely last longer than 3 to 6 weeks. Complications may occur but are rare. As you see on the picture, right side, the sclera shows yellow discoloration and the patient having itching on the lower picture. Complication of acute viral hepatitis is acute liver failure, cholestatic hepatitis, usually with hepatitis A virus, aplastic anemia, chronic liver disease, and cirrhosis, which is mainly with the hepatitis B and C most commonly, and the relapsing hepatitis. If we do the investigation in acute hepatitis, the serum transamylases, that is alanine aminotransferase ALT and aspartate aminotransferase AST, typically between 200 to 2000 units per liter in acute hepatitis. Plasma bilirubin reflects the degree of liver damage. It means if the plasma bilirubin is high, it shows the increased liver damage. Alkaline phosphatase rarely exceeds twice the upper limit of normal. Prolongation of PT indicates the severity of the hepatitis, but rarely exceeds 25 seconds except in acute liver failure. WBC is usually normal with relative lymphocytosis. Serological tests confirm the etiology of the infection. As far as the management is concerned, no hospital care is required. Sedative and narcotics which are metabolized in the liver should be avoided. No specific dietary modifications required. Alcohol should be avoided in acute illness. Elective surgery should be avoided in case of acute hepatitis because there are risk of post-operative liver failure. Liver transplantation is very rarely indicated for acute hepatitis complicated by liver failure, commonly performed in cirrhosis resulting from chronic hepatitis B and C infection. The large family of the hepatitis virus are A, B, C, D, and E, and the family genus are shown. In this, if we see the genome, only hepatitis B virus is DNA, while the hepatitis A, C, D, and E having the genome RNA. Hepatitis A virus. Nature of hepatitis A virus, it is enterovirus included in the family Picornaviridae. Its size is 27 to 30 nanometer, spherical particle with cubic symmetry. Contain linear single-strand RNA genome, non-enveloped RNA virus, replicates in the cytoplasm of the cells and having only one serotype. Epidemiology, a major communicable disease in the developing world. Community hygiene is important in schools, hostels, and jails as overcrowding and poor sanitation favor the spread. Well cooked food and sanitary water supply will protect. Many cases occur in community wide outbreaks. Highest attack rates in 5 to 14 years olds and children serve as a reservoir of infection. Persons at increased risk of infection are travelers, homosexual men, injecting drug users. Geographic distribution, if we see the red area is showing the high prevalence, and you see that it is in the subcontinent, China, Middle East, Africa, South America, and yellow show the intermediate. It also covers the Russia and the other states, and then is the low greenish show the North America and Australia, and very low in very, so it is endemically present all over the world. Transmission is by fecal oral route, ingestion of food or water contaminated even in microscopic amounts. Virus appears in the feces about 2 weeks before the appearance of the symptoms, and this virus present in blood and feces 10 to 12 days after infection. If we see the pathogenesis, it enters through the mouth, multiply in the oropharynx and intestinal epithelium, and through lymphatics and bloodstream, it enters into the liver. Hepatocytes are infected, but no cytopathic effect on hepatocytes has been observed. Cytotoxic T cells produced during the immunological reaction cause the damage which is repaired, infection clears, and no chronicity develops. In acute phase of the disease, IgM antibody appears, diagnostic, followed by the appearance of the IgG antibodies which make the person immune to further infection. Clinical findings, as we said already, that incubation period is 2 to 4 weeks. There is prodromal symptoms like fever, anorexia, nausea, vomiting. Then the patient may develop jaundice, liver tenderness, dark urine, and pale feces are usually before the appearance of the jaundice. Most hepatitis A virus infection are asymptomatic and detected only by the presence of antibodies. No chronic carrier state, no chronic hepatitis, no predisposition to the hepatocellular carcinoma. Recovery within 4 to 6 weeks, but complications, fulminant hepatitis, cholestatic hepatitis, and relapsing hepatitis. Mortality is 0.1 to 1%. Laboratory diagnosis: acute infection is diagnosed by the detection of the hepatitis A virus IgM in the serum by ELISA test, and past infection is determined by the detection of the hepatitis A virus IgG. Cell culture difficult and take up to 4 weeks, not routinely performed. Direct detection by PCR of hepatitis A virus in feces can detect the illness earlier than the serology, but rarely performed. Hepatitis A infection, if we see this graph, we see the hepatitis A virus is seen in the fecal and before the appearance of the symptoms, and the patient having IgM, yellow graph, shows that it goes up and then goes down within the 6 weeks, and IgG for prolonged, and it shows the immunity in the person. Treatment: no antiviral therapy is available, bed rest, and during the period of anorexia, the patient should receive frequent small IV fluid with glucose. Advise patient to avoid substances that may affect the liver function. Medication like acetaminophen, herbs, illicit drugs, and toxins should be avoided. Be very careful about personal hygiene to avoid fecal oral transmission to other members of the household. Prevention: active immunization with vaccine containing inactivated hepatitis A virus is available, and the passive immunization with immune serum globulin, if given prior to infection or within 14 days after exposure to infection, can prevent the disease. Vaccination of the hepatitis A is recommended for all children starting at the age of 1 year, travelers to certain countries, and at high risk. Safe and effective formalin inactivated vaccine containing hepatitis A virus grown in human diploid cell culture is available. 2 intramuscular injections, first dose and the booster dose after 6 months and between the 18 months should be given, and protection starts after 4 weeks after injection and lasts for 10 to 20 years. It is recommended in the international travelers, homosexual men, injection drug users, persons with occupational risk, patient with impaired immune system or CLD, patient with blood clotting disorders, healthcare workers, child care centers, sewer workers or plumbers, and food handlers. Hepatitis E. It belongs to the calcivirus-like viruses. Non-enveloped RNA virus, size is 32 to 37 nanometer. Single-stranded RNA genome, very labile and sensitive, can only be cultured recently. Epidemiology: most outbreaks and epidemics associated with fecally contaminated drinking water. Several other epidemics occur in Indian subcontinent, USSR, China, Africa, and Mexico. In United States and other non-endemic area where outbreaks of hepatitis E have not been documented, a low prevalence, that is less than 2%, have been found in healthy population. Minimal person-to-person transmission. Geographical distribution: if you see, it is seen reddish area. Transmission: it is present in the stool of person with hepatitis E, spread by eating or drinking contaminated food or water, and transmission from person to person occur less commonly than the hepatitis A virus. Pregnant women are more prone to develop hepatitis E virus. If we see on the right side of the picture, person engage the hepatitis E virus intake through contaminated food or water, enters into the stomach, then goes into the virus and multiplies, and then travel toward the GIT, and the virus enters into the body and blood in the stool, and then they are excreted. Clinical feature: incubation period average 40 days. Case fatality rate is over 1 to 3%. Pregnant woman is 50 to 25%. Illness severity increased with age and chronic sequelae not identified. The patient having jaundice, fatigue, abdominal pain, loss of appetite, nausea, vomiting, and dark urine. Hepatitis E virus infection graph, if you see the symptoms, during symptoms there are increase in ALT and the IgM goes up, and within 12 weeks it goes down, and IgG anti HEV are developed, which shows the immunity. Laboratory diagnosis by detection of the hepatitis E virus IgM in serum. Past infection shows by the detection of the hepatitis E virus IgG. Cell culture is difficult and takes up to 4 weeks or not routinely performed. Direct detection by the PCR of hepatitis E virus in feces. Prevention and control measures: no vaccine available for hepatitis E. Unknown efficacy of Ig preparation from donors in endemic areas. Being a waterborne disease with fecal-oral transmission, the steps and measures as discussed under hepatitis A virus prevention are also useful for hepatitis E virus prevention. This is a last slide. If we see, compare the hepatitis A and E, it shows the virus group. Hepatitis A have an enterovirus, while hepatitis E is a calcivirus. Both having RNA genome. Size is almost equal. Incubation period for hepatitis A is 2 to 4 weeks and hepatitis E is 3 to 8 weeks. Spread fecal-oral, yes. Chronic infection not seen in both, and prevention is seen in hepatitis A by active by vaccine and passive by the immune serum globally.